18 questions about healing from DPDR. Today I'm going to do something a little different. I've gathered all the different questions that I found about how do I heal or surrounding the healing of DPDR. I'm going to answer all 18 questions. The summary of the 18 questions about healing from DPDR, answered by me, Ben Meijer. Question number 1. Can I heal from DPDR? Question number 2. Can you fully heal from DPDR? Question number 3. How do I heal from DPDR? Question number 4. How can I cure DPDR? Question number 5. How can I beat DPDR? Question number 6. Why haven't I healed from DPDR yet? Question number 7. Why does my DPDR come back? Question number 8. What is the fastest way to cure DPDR? Question number 9. Can you fix depersonalization? Question number 10. Can you reverse depersonalization? Question number 11. Will DPDR come back? Question number 12. I've had DPDR for X number of years. Can I still be healed? Question number 13. Why does my DPDR come back? Question number 14. Why does my DPDR get worse over time? Question number 15. Will my DPDR ever go away? Question number 16. Can DPDR be permanent? Question number 17. How long does depersonalization usually last? And question number 18. Can depersonalization last for years? Those were the questions. Now on to answering them. First question, can I heal from DPDR? The short and quick answer is of course you can. But healing from DPDR, let's just use some common sense first, okay? If somebody asks me, can you paint my house for me? Well, yeah, I could paint your house on the outside, but we're assuming a lot of things. First of those things is that you're going to pay me for this painting job. The second is that it's not going to be freezing outside. If it's negative 20, I'm not going to be painting your house at all. And so a lot of these assumptions really come into play when you're talking about healing from DPDR. Can you heal from DPDR? Yes, healing is a process that you can do. Yes, but it requires a lot of things. For instance, that you take care of your anxieties, you remove traumas, you set the stage to enable healing. In therapy, I call this the preparatory phase. And the first thing is there enough acceptance? If you don't accept whatever's going on, you certainly cannot heal. So, question number 1, can I heal from DPDR? Yes, but. And there's a lot of buts. Are you willing to do whatever is necessary? Are you willing to go in therapy? Are you willing to deal with your anxieties? Are you willing to change? Are you willing to change the way you deal with life? There is a requirement. Do you have a healing plan? Do you know exactly what the processes are to healing? What are the steps per process? If you don't have a plan, you're not going to reach the point you want to reach. Do you have the techniques to be able to take those steps? Those are intervention techniques. Are you willing to be uncomfortable? This is a requirement. To be able to heal, you have to be willing to tolerate the discomfort. Therapy isn't fun. You don't relax your way into healing. You have to actively engage the discomfort and remove it through active engagement. Question number 2. Can you fully heal from DPDR? Here's a question that asks us to look better at what does cure or heal mean? And the answer is, for me, a cure is when the symptoms are all gone away, so there's no anxiety left and there's no DPDR left, and this is permanent. And my experience is that you can treat it, you can treat and remove all the anxiety, you can treat and even remove the whole mechanism, but that means that all the symptoms are in remission, and in the future these symptoms can be triggered by life. So a lot of people experience that at a certain point the symptoms are all gone, and then 8 years down the line they have a relationship crisis, they get divorced, or God knows what, you go bankrupt, and then your symptoms come back. But that's normal. Life happens and life impacts us all. So yes, you can fully experience remission for many, many years. Some people have remission for 10, 15, 20 years. And you can get triggered again. It doesn't mean it's going to be coming back the way it used to. It just means that you have some new issue, some new crisis in your life. Question number 3. How do I heal from DPDR? Well, healing is a number of processes. And these processes require that you change as a person and change in the way you interact with all sorts of things in life. And yes, in the first phase, the way I deal with healing, it's about removing anxiety, stress, panic attacks, traumas, and that kind of stuff. And that is in itself a number of processes that don't really take that long if you have very useful and working intervention techniques. So that means useful technique does not mean we're going to be talking about the issue. It means we're going to be resolving the issue using an intervention technique. After that, in phase 2, we're going to be dealing with how do I reconnect mind and body? And there's a number of techniques that will do that. And I've just been Googling some of the things that Google says. A lot of the things that Google says are not very useful. They're more wishful thinking. Question 5. How can I beat DPDR? Please, 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 don't talk like that. If you're going to beat DPDR, who has the DPDR? You do. That means you're going to beat yourself? How does it feel to be beaten? How does it feel to beat yourself? Beating yourself doesn't feel good. And if you talk about beating, you have an attitude towards yourself where you're not very gentle. You're competitive and you're judging, you're not helping. Cure sounds way better than beat. Please don't talk about beating. Do you like this content? Please like and subscribe. Why haven't I healed from DPDR yet? Well, I don't know, but a lot of people somehow assume that healing from DPDR will come automatically and all by itself. I have no idea why you would think that. Some people experience spontaneous healing from all sorts of mental issues. Anxieties, sometimes if you just live life and don't go around the issues that are difficult but just deal with them on a daily basis, you'll notice that you can grow in them For instance, take the simple example of fear of public speaking. If you keep speaking in public, with time you will grow in this ability, and your anxiety, your fear will decrease just by doing. And it's been documented that some fears actually dissipate and get relieved by just engaging with life, just doing the daily things like speaking in public. Same goes for depression. Some people do not take any form of medication or therapy and still have their depression improve, especially if that depression is related to your relationships in life and you've improved those relationships. But if you expect a spontaneous recovery from DPDR without doing anything, it happens, but a lot of people don't watch this video because it has happened to them. A lot of people experience the exact opposite. DPDR, when untreated and unmanaged, tends to first come in episodes and then get worse. But that is because you don't accept the responsibility to actually look at the DPDR and your life more closely and change something for the better. So the next question is, why does my DPDR come back? I've already talked about DPDR coming in episodes, and a lot of people will have DPDR after having some life event or taking recreational drugs and having a bad trip, and then it'll stay for a couple of weeks, maybe a couple of months, and then it'll just somehow dissipate and disappear spontaneously. But if you've had it once, it can come back later. Something else in life will trigger you, and it'll trigger the whole DPDR and it'll come back up. So you can have a second episode. Now, my experience is that quite a few people have a number of episodes, and then when they start thinking about DPDR and start worrying about the DPDR, it gets worse, it stays longer, and it's harder to let go of. So that's my experience. The next question, question number 8. What is the fastest way to cure DPDR? I don't know. I wish I knew. I try my best. I have a therapy program, and I have described the processes that need to be done. But I'm still learning. I use a number of techniques. I use ACT. I use a framework developed by Philip Shepard. I use a little Thomistic psychology. I use exercises from different fields of therapy. I've just gathered everything together that I need. And I'm sure there's tons of other ways to approach this. So what the best way is, I don't know. I know my way, and I know my way works. The next question, can you fix depersonalization? You can treat it, you can spontaneously recover, but to fix is almost like you're tinkering with a broken clock or something, you know. I don't know if you can fix depersonalization. Can you reverse depersonalization? Question 10. Can you reverse depersonalization? Yes, in the sense that if you decrease the stressors and anxiety, or improve your sleep, if that's the cause, then it goes away. Yes, it's about processes, and if you depleted your energy, then you will get depersonalized. So if you fix that part will improve. Will DPDR come back over time? My experience is yes, DPDR will come back over time when life stressors happen, especially during crises. Question 12. I've had DPDR for X many years. If that's 8, 10, 12, 15, it doesn't really matter. It's the same question. The question is, can I still heal after 8 or 10 years? And my answer is yes, because it's about processes, not the length of time that somebody has it. I've had quite a few people who were very successfully healed, who've had it for 12 or 15 years, even 25. But I've also had a number of people who've had it 25 to 40 years or 50 years, who are very habituated in the pattern of being in DPDR. In other words, in theory it's possible, but it's uncomfortable to get out of the DPDR. Sometimes people get attached to being in the state of DPDR. It becomes normal, which is of course not conducive to health. And to heal, you have to be willing to be uncomfortable. I've said this before in another question. To heal, you have to accept, tolerate that you're going to feel uncomfortable for a particular period of time. And you're going to have to actually look for where that discomfort is. What kind of wording, what kind of fears, what kind of convictions, negative convictions, make you feel uncomfortable. And you have to go there. You have to resolve those. That's it. Thank you. Next. Do you like this content? Please like and subscribe. Why does the DPDR come back? Well, because life is impacting you, and some things you're not strong enough to deal with yet. Why does DPDR get worse over time? Quite often because a lot of people haven't fully accepted the responsibility to deal with their emotions and how you're dealing with life. Will my DPDR ever go away? Well, that's all about your responsibility. Do you accept your responsibility? Then it will go away. Can DPDR be permanent? Again, this is your responsibility. I've encountered people who've had DPDR for 49 years, 20, 25, all different people. Quite often, if they've had it for 20 years or longer, 30 years, it's because they didn't deal with it back then. How long does DPDR usually last? Unfortunately, trying to compare yourself with other people, and that in and of itself really isn't a useful exercise. You should compare yourself with yourself 6 months ago, a year ago, 2 years ago, 5 years ago. How long does it usually last? If somebody experiences a traumatic event and then doesn't do too much about it, quite often it will dissipate, disappear in a couple of weeks to a couple of months. But this is really dependent on if you can let it be. If you can just let it go, whatever happened, let it go, and continue living, continue engaging life here and now, it will go away. Of course, you could also treat that trauma and then let it go. That's a much more effective approach. Can depersonalization last for years? Last question, number 18. Absolutely. Like I said, I met one woman who had it for 49 years. And even she could be helped. Now, people who've had it 25, 30, 35 years are a little harder to help than people who've had it a couple of years. there's no cutoff point. It's often just a matter of how much time and energy are you willing to invest in the healing. Are you willing to do the exercises, take the steps in along the processes and move forward? That is what determines the outcome. Would you like my assistance in helping you cure your DPDR? I offer both one-on-one therapy. I have a video self-help course, and recently people have asked me to offer group therapy. Now let me know if you're interested in group therapy. Otherwise, the other two options are there: one-on-one therapy and a video self-help course. Let me know what you want, and I'll see you then. Please reach out to me, call me, text me, or email me. The details will be on this screen right after this video, and they'll be below the video in the description box. See you soon. Have a good day.